time to address an anesthesia controversy. Should patients with aortic stenosis receive a spinal anesthetic? Here's the issue. The arteries that supply blood flow to the heart itself branch off just after the aortic valve. There needs to be enough blood pressure in the aorta, which is the large blood vessel that the aortic valve feeds, in order for the coronary arteries to receive enough pressure and blood flow. Without this, the patient could suffer hemodynamic instability or a heart attack. When a patient has aortic stenosis, they're very dependent on having enough blood pressure in the aorta. However, when a patient receives spinal anesthesia, this often causes a drop in the blood pressure. Spinal anesthesia is often the preferred method of anesthesia for many surgeries, including cesarean sections. So should a spinal anesthetic be offered in these patients? The Anesthesia Patient Safety Foundation's newsletter editorial board thought this was a great question to answer and reviewed a summary written in the Journal of Cardiothoracic and Vascular Anesthesia. This review pooled over 3,000 patients reported in the literature undergoing many types of surgery who had aortic stenosis. The most common complication, as expected, was low blood pressure that needed to be treated with vasopressors. Regardless, there were no cases of cardiovascular collapse or mortality. The overall 30-day mortality was only 0.74%. The authors concluded that perhaps neuraxial anesthesia may not be an absolute contraindication for patients with aortic stenosis. Many questions remain, but do you think this might change your practice? Like and follow for more.